Remember to subscribe and don't forget to hit the bell icon to never miss an update from Tips for Daily Life.
During pregnancy, some common infections like the common cold or a skin infection do not usually cause serious problems. But other infections can be dangerous to you, your baby, or both. Some infections may lead to preterm birth and low birth weight babies. Others can cause serious illness, birth defects, and lifelong disabilities, such as hearing loss or learning problems. Here's what you can do while you're pregnant to protect yourself and your baby from infections. 1. Maintain good hygiene. Wash your hands often, especially when you're around or caring for children. Regular hand washing, particularly before and after certain activities, is one of the best ways to remove germs, avoid getting sick, and prevent infections. It's especially important to wash your hands before and or after certain activities like after using the bathroom, before handling food, and after blowing your nose. If soap and running water are not available, you can use alcohol-based hand sanitizer gel. 2. Cook your meat until it's well done. The juices should run clear and there should be no pink inside. Ground meat should be cooked to a minimum of 71 degrees Celsius. Cook poultry to at least 74 degrees Celsius. For other meat like beef and pork, cook it to a minimum of 63 degrees Celsius and let it rest for several minutes after cooking. Do not eat hot dogs, luncheon meats, or deli meats unless they are reheated until steaming hot. These undercooked meats and processed meats might contain harmful bacteria called Listeria monocytogenes. 3. Avoid unpasteurized milk and foods made from it. Do not eat soft cheeses such as feta, brie, and queso fresco, unless they have labels that say they are made from pasteurized milk. Unpasteurized products can contain harmful bacteria. 4. Talk to your doctor about vaccinations. Some vaccines are recommended before you become pregnant, during pregnancy, or right after delivery. Having the right vaccinations at the right time can help keep you healthy. For instance, the flu vaccine is especially important when you're pregnant. Vaccinations can also help keep your baby from getting very sick or having lifelong health problems. 5. Avoid people who have an infection. This is especially true for infections like chickenpox or rubella. Chickenpox can cause pregnancy complications and birth defects. Rubella can cause serious birth defects and put you at risk for miscarriage or stillbirth. Stay away from anyone who has these infections if you have not yet had them yourself or if you didn't have the vaccines before you got pregnant. During the COVID-19 pandemic, be sure to follow recommended safety measures, wear a mask, avoid crowds, and practice social distancing. 6. Do not touch or change dirty cat litter and avoid contact with potentially contaminated soil. Have someone else do it. If you must change the litter yourself, be sure to wear gloves and wash your hands afterward. Dirty cat litter and soil might contain a harmful parasite that causes an infection called toxoplasmosis. 7. Zika virus. Zika virus infection in a pregnant woman can cause the baby to have a small head, microcephaly. The head is small because it does not develop normally. Zika virus infection can also cause eye abnormalities in the baby. The Zika virus is spread by mosquitoes, but it can also be spread through sexual intercourse, through blood transfusions, and from a pregnant woman to her baby before or during birth. 8. Get tested for sexually transmitted infections, STIs. Some people that have STIs do not feel sick or have any symptoms. It's important to know if you have an STI when you're pregnant because this can have serious effects on you and your baby. If you do test positive for an STI, talk to your doctor about what you can do to protect yourself and your baby. Some STIs are treatable while you're pregnant. Be sure you're using safe sex practices to prevent STIs. Treatment. Sometimes drugs, depending on the balance of benefits and risks to determine whether to treat pregnant women with antimicrobial drugs, doctors weigh the risks of using the drug against the risks of the infection. Some antibacterial drugs, such as penicillins, cephalosporins, and drugs related to erythromycin, called macrolides, are generally considered safe for use during pregnancy. Other antibacterial drugs, including tetracyclines and fluoroquinolones, may cause problems in the fetus. Doctors also consider whether treatment is likely to have any benefits. For example, if women have bacterial vaginosis but no symptoms and if the pregnancy is not considered high risk, treating bacterial vaginosis is not known to have any benefits.
Thanks for watching. To get the latest videos related to health and medical topics, please subscribe to our channel. If you like this video, kindly share it with your friends and family. Do not forget to hit the like button. If you have any queries, please comment in the comment section.